Hey, Cancer Warriors, it's Tanya with Power Pantaloons Podcast, and today our special guest is Krystal. Welcome to the show.
Hey everybody.
So why don't we start by you introducing yourself and telling us a little bit about you?
Alrighty, so my name is Krystal. I am originally from New York. Spent most of my life there, 26 years there, and then 2 years in Nashville, Tennessee. And then I moved to Florida. So that's where I'm located now. I live in Miami, Florida. And last year of May 2023, at the age of 33, I was diagnosed with stage 2 invasive ductal carcinoma. And I've been through 7 surgeries so far, and my last one is going to be in 2 weeks. So I'm sure we'll get into all that. But yeah, so thriving, officially, I guess, in remission or cancer free, whatever you want to call it. And now I'm here to kind of help everybody else get through their journeys.
Right? Isn't that what it's about? Sharing your story and helping other people.
Exactly.
So, say what kind of cancer it is again?
So I had stage 2 invasive ductal carcinoma. I am ER positive, so hormone positive. No lymph node involvement. We removed 9 lymph nodes, and none of them were cancerous. So
Okay. So is that a form of breast cancer?
it's breast cancer.
It is
Yes.
breast cancer. Okay. I thought so, but I wanted to make sure. So I'm a uterine cancer survivor of, in March, it'll be 17 years.
Wow. God bless.
Yeah, it's when that doctor says you have cancer, there's just that whole Charlie Brown teacher thing. Womp 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 womp, right? Like, so why don't you talk about your Charlie Brown moment?
So actually, while you said that, I got the chills because it was like I blacked out. I literally blacked out, and at the end, I was like, "Are you telling me I have cancer?" Because I didn't know the words invasive ductal carcinoma. They use all these crazy words, like thinking that I would know what it meant. But I had no family history of any kind of cancer, so I never even heard those words before.
Wow.
So and for me, it was really difficult because, and my doctor knew this because when I went in for my ultrasound and my biopsy, they said, "Hey, like on the ultrasound, we're looking at this thing. This is nothing. Like, call your mom." Because I was like, my mom's freaking out. She's back home, and like, call your mom right now. Tell that her you're fine. Go home, get some sleep because this is nothing. We can tell right from the ultrasound. So I was already expecting
God.
not to have anything. And it wasn't her fault. I mean, every doctor that I saw, they couldn't even figure out how big it was. They showed me the ultrasound, they showed me the biopsy, that they took videos of it, and they're like, we can't figure out how big this thing is because my breast tissue was so dense. It was
Sense.
like hidden inside, and it looked normal. So I was expecting good news from the doctor, and when I heard that, I was like, wait a second, what? I had no idea what to do, literally no idea.
Yeah. So the reason I'm so emotional right now is in December I went in for my routine mammo and I thinking no problems, right? Well, that's not the case. I have three masses and I went in Tuesday to see the oncologist so she could recommend the biopsy, and the biopsy is scheduled for the middle of February. So I have, a
Okay.
month to go before I can even have my biopsy. And
Oh my God, I'm so sorry. I mean, listen, there could be masses, like, I've learned so much. There are masses that could be literally anything, like,
yeah,
literally anything. So, but I'll pray for you. And honestly, why is your doctor waiting so long? Like, that's not okay.
well, that's the earliest appointment available at the radiologist. Yeah.
Get a different radiologist because that's gonna eat you alive for the next month. I can't even imagine having to wait that long.
Well, after having the conversation with the oncologist, I felt really good. Um, and when the radiologist looked at it, they're very clearly defined, and I was actually able to look at the ultrasound and me looking at it. Not that I'm an expert, but there were none of the phalanges on it at
The
all.
little
It was very,
fingers.
very clean margin, very what you would expect not to be cancer.
Good.
So I feel really good about that. So
Perfect. Okay, well, that's good news because usually the doctors can see like, oh, it has like asymmetrical lining, and you just like kind of like a mole, on your body.
Yeah.
The circle ones are the good ones. The ones that are bad have like little things growing out of
Yeah.
them.
Yeah.
So
They have phalanges or
yeah,
tentacles or whatever you want to call it. So
yeah,
yeah. Yeah. So right, like like the radiologists actually use the words it's not cancer, right? Like they don't ever say that. They're not supposed to say that. So I totally get why you thought you were in the clear, right? Like it's fine. There's nothing here.
yeah. But you know what? The thing is with breast cancer is that if it's detected early, it's not a death sentence. I mean, look at me. I'm 8 months in, and I have my last surgery. It was quick. It was so quick. Chemo, surgeries, I mean, in and out. For some people, the journey is not as short, but if it's caught early on, it's a short journey.
Yes. Yes. Um and, and cancer is sneaky, right? Like so I'm gonna stand here and talk about doing all of your routine tests on time, just do them. Whether they're uncomfortable or not, just do them because routine tests do save lives.
Yeah, absolutely. And honestly, biopsies are not bad. Like it pinched, it wasn't that bad at all. They give you a little like anesthetic, so it's numb. But even if there's something that you might think is there and the doctor is like, let's do a biopsy, just say yes. Like there's no reason to not do it.
Exactly, exactly. It's much better to know what you're dealing with than wonder and create things in your head because I am a big proponent for mindset and the power of your mind. I I had stage 3, phase 2 uterine cancer, and it was two different kinds of cancer. It was a carcinosarcoma, and everybody expects you to have markers in the blood. And that was not the case in my case. There's no markers in the blood. The pap smear, the ultrasound, the transvaginal ultrasound, something called a sonohistogram, which is where they inflate the uterus with saline and then they do an image. All of that came back fine or inconclusive. They actually had to do a D&C to find my cancer.
It's
Eh,
sneaky little bastard.
But I knew something was going on and I advocated, and my gynecologist was like, okay, so, well, this came back negative or inconclusive. Our next step would be blah. Do you want to proceed? I didn't have any of that crazy, like some of the stories I hear about the care people are getting, it just blow my mind.
Yeah. It's absolutely that is so true. I have a friend that called me crying, two friends actually, that they felt lumps because ever since I was diagnosed, all my friends are like now they're
You're
checking
the
it,
expert.
and she had a lump and the doctors are like, no, you're too young for a mammogram. And like no one was taking her. So now she has to go to a clinic. I think she has to they're charging her like 250, which is not bad compared to like other places. But they're like, no, you're too young. And I never had that experience because I was, diagnosed immediately. Once you're diagnosed, like the doctors, PET scans, CAT scan, everything, they're like, all right, here's it all. Insurance has to cover it. But I had no side effects of cancer. Like I didn't. I wasn't tired, fatigued. I didn't have any pain. There was just a lump, and that was felt like 2 years ago. And when I originally got it checked out by a radiologist, they said it's just dense breast tissue because I had large breasts naturally. And they sent me home like, don't follow up, you're good. And then a year later, I moved to Miami, a new city, and I was like, I needed a routine physical because I always go every single year. And my new doctor was like, "Hey, like, do you know you have a lump?" And I was like, "Yeah, last year I got it checked out." She's like, "Okay, but just for like a peace of mind, can you go for me?" And I was like, "Sure, whatever." And I was supposed to go, and then my car, my battery died or whatever. And then I had a work trip, so it kind of took me like a month or two to actually go. So throughout that time, the lump grew. It was like in breast cancer, you have grades. So grade 1, 2, and 3. And I was a grade by the time they got 2/3. So it was pretty growing pretty quick. So the first radiologist never caught it. They said it was nothing. Second one, she said it's nothing, but let's do a biopsy anyway. And that's how they're the ones who saved my life, I guess.
Yeah, absolutely. The the details. You following up, right? Like it hadn't you if you hadn't moved, like
I'd
because
be walking around.
you can't
I,
think like that, right? Like because it'll make
true.
you go crazy.
Yeah, because if I didn't move, I would have stayed with my same doctors who told me I was fine. I'd be walking around right now with cancer, probably at stage 3 or 4 by now. And that's what happens with people who have stage 4. They don't know they have it. Like I met a girlfriend down here in Miami. She's 30, she was 30 years old. She was diagnosed, she had an itch in her armpit. You know, it was nothing, no crazy side effects, no
Yeah.
symptoms. Like it's just something little. My cousin's mom had breast cancer and she didn't have a lump. She didn't have a pain. It was a little indent on her breast. So it's things like your doctors, when you're young, they don't tell you, oh, they just say if you feel a lump, get it checked. They don't tell you if you have an armpit itch or lymph node swollen or an indent or skin that looks like an orange. They don't tell you that. They just say lump and that's it. So we don't know.
No, and the education in this country is abysmal when it comes to any kind of advocating for yourself or even knowing what to look for, as you were saying, Crystal. Like which is why this kind of thing is so important, having discussions about it and talking about it, because you just taught me something I didn't know about the orange thing. The
Mhm.
texture, right? Like you're talking about like the
Yeah.
texture. Yeah. So there and everybody's body is different, right? So, and how cancer will present to you is going to present completely different to somebody else. And a lot of us don't have signs. It's just some weird thing that we magically discover. And
Absolutely.
that is ridiculous. It needs to be, we need to do better as a society, right? Like to talk to each other, to help each other. And so, yeah. So walk us through what chemo was like for you.
Okay, so I'm like the type of person that like wants to know everything. I prepare myself. So I did so much research. So the cancer hospital, they'll do like a little chemo class with you, but before I even went, I knew everything. Like I was like pretty much over prepared because they were like, "Oh, you already know that. Oh, you already know that." I'm like, "What about this?" They're like, "Oh yeah, we forgot to tell you that." So I went on TikTok, Instagram. I talked to a few people that I met in the community. I had a girl that I grew up with. She was also in her 30s. She helped me a little bit, but everybody's journey is different. So I kind of pieced together everybody's stories and what they did that helped them. And I also did a lot of reading, like research. So I came up with my own way to go into chemo. So like with the cold cap, the gloves on your on your hands, your toes for neuropathy. I did it all. Like even if I didn't, if the doctor's like, yeah, I might not need that. I did it just because I didn't want any effects. Um, I had weird chemo side effects. Like my doctor like laughed. He was like, one point he called me superwoman because I wasn't getting a normal like patient's chemo symptoms. I was getting more of like flu like. Like I would get the flu for 24 hours basically, and that was it. So I would have chemo, and then 24 hours later, it was like every single chemo session, 24 hours later, I had a 24-hour flu. And it was like the exact symptoms. I had a high fever of 102. I would get the chills. I didn't throw up. I didn't have diarrhea like normal, chemo patients. It was just like a 24-hour bug. Um, I don't know if it was because of this. For me, I prepped a lot. Like I would eat grass-fed organic red meat 3 days prior to chemo. I read in a weird article from like 1980s that people were doing that. I did that. I also juiced for the week prior, like celery, anything green. I was eating all the grossest like spinach and all, putting avocados in my shakes. Like anything that I saw that was green, I was eating. And then I was drinking a shit ton, like lots of lemons in my water. And honestly, that worked for me. I was never tired, like fatigued or anything like that. And, I told my doctor that, and he was like, "Well, how do you know that you didn't have any side effects because of what you did?" And I go, "Well, clearly something worked." So now all the
Yes.
girls that I coach, I tell them about this. The last two that I coached, they both, one of them barely had any side effects, literally barely any side effects. And then the one that I just coached, she went through her first chemo, had every side effect in the book: throw up, nausea, like sickness, everything, fever. I told her to change what she was doing. I gave her my tips, and she just made a video on TikTok and name dropped me and was like, "Thank God for her because I had zero side effects of the chemo this time.
Yeah,
So
absolutely.
sometimes you just have to like do your own research. Like the doctors, I mean, they'll give you your medications, your nausea medication, but you got to incorporate some kind of, your own thing.
Oh, I did the whole holistic mind, body, spirit thing. I added aromatherapy, flower essences, grounding, detoxifying baths. Um, like literally every morning when I woke up, I visualized I was putting on Wonder Woman's underwear because Wonder Woman doesn't die. That's actually where the name Power Pantaloons comes from that practice. And I they gave me a 5% chance of survival. Like I did not have really good odds.
Really? Holy moly.
A healthy uterus is 4 ounces. When they took mine out, it was over 10 pounds. Yeah. So yeah. So I really, really believe, and I know all the way to the bottom of my toes that me visualizing putting on Wonder Woman's underwear every day, that was me actively deciding to live every day and fighting for my life. And for me, Reiki and crystals in my bra and sound healing and all of the you want to call it woo woo stuff, but yes, I used all of the woo woo stuff in addition. I'll be 1,000% honest. I didn't fix my nutrition during that time. I have since fixed it, but I and that's what I coach everybody. Fix your nutrition. Fix
Yeah,
that because putting the right fuel in your body makes a huge difference in how the chemotherapy affects you.
so true.
It is true, right? Like, and I had a rough time. I was basically a 300-pound cat for a year. Like, there was so much sleeping. But my chemotherapy was inpatient, and they
Yeah,
had to give me rescue drugs before, during, and after my chemo because the chemo was so toxic.
yeah.
So, nutrition wise, I agree with you. Grass fed, as organic as you possibly can, vegetables. A lot of people talk about juicing and how wonderful it is and how helpful it is.
Now, I know that a lot of doctors are against juicing because it takes out the pulp of a fruit and the vegetables. So that's where a lot of the nutrition comes from. So you have to juice, but you also have to eat the raw fruits and vegetables too. So like that's one thing that I learned. Like celery, a lot of the nutrition comes from those little strings in the celery that nobody wants to eat. But so I incorporated both, and I pushed that diet onto myself right now, and no alcohol, obviously. But I have noticed. I mean, I lost. I mean, I was never, I'm fairly thin, but I feel so good. My body's super thin, and I eat so clean. Everything that you need: the berries, the nuts, a lot of veggies and fruits, and I just feel really good. Like my body just feels really good.
Stay away from the processed foods. Stay away from
Don't touch
gratuitous
it.
sugar. I mean, cancer eats sugar.
Yeah,
Stay
I
away from
just
it.
I started. So there are supplements: turkey tail, lion's mane,
The
chaga,
mushrooms, the
mushrooms. I
mushrooms.
drink them
Yes.
every day in my matcha tea, but I don't even put milk, or I don't put sugar, nothing. I mix it all together, and it's a little earthy drink, but I drink it every single morning because I don't want this thing to come back. So that's doing whatever I
I
can.
I blend my own. It's got shaga, it's got cordyceps, it's got lion's mane, it has reishi. I can't find turkey tail. Somebody gave me a thing so I could add turkey
I'm,
tail to it. It has
yeah,
ashwagandha and turmeric and Oregon grape, which is where you get the berberine from, and then all of the cinnamon, clove, nutmeg, cardamom kind of deal, right? Like so
yeah.
and I'll add some honey to it, and then I'll add a heaping spoonful of cacao.
You can do dark organic maple syrup too. That's good. Sometimes I prefer that over honey. On my I make like protein balls. I've been doing a lot of dark organic maple syrup, and it tastes really good.
Yeah, like I'm kind of a honey snob. I love the different eyes.
I love honey too, but honestly, dark maple syrup, I don't know, it's something about it. It's just so sweet. I don't know, it's different.
Sounds amazing. So tell me about your chemo. Was it outpatient?
It was outpatient, yeah. So I would go. Um, I was able to bring somebody with me, so my friends would come with me because I needed somebody to like ice my fingers and my feet. I don't know what kind of chemo you use, but the one that I did causes long term neuropathy in your fingers and your toes. So it's like pins and needles. I never got it because I would keep my fingers and toes on ice, and that was horrible. Like literally the worst ever. But I was like, you know what? I gotta live right now with these stupid gloves, and then eventually I won't have neuropathy, and it works. So
Yeah. I have interviewed several breast cancer survivors, and I learned about the cooling caps and the gloves and the I was like, oh, like I didn't have any of that at all. My chemotherapy was called cisplatin, and I think it's specifically not a breast cancer uh,
yeah,
chemo.
it's every chemo is going to be different. So for breast cancer patients, typically the ones that we have, like the concoction that we have, you lose your hair immediately. I lost my hair, every piece of hair I lost within 10 days, 2 weeks. So this is a wig. So I do rock the wigs. My hair is like a short boy's haircut right now. So we're getting some. My eyebrows are starting to go back. My lashes, I got lash extensions. So nobody could tell I was a cancer patient. I always had wigs, always had my lashes like glued on. But that's the one thing about the breast cancer. I did not do cold capping. I decided against it for multiple reasons. I can share that if you'd like, but
Yeah, let's talk
you know,
about that.
it's just my own opinion. It works for some people, and I felt like I needed chemo to do its thing, and by preventing it from going into my head, I felt like it wasn't going to get hit my brain. So if there was, God forbid, brain cancer cells or something going on in there, I felt like the chemo needed to hit every part of me. So that was my first thing, because I would hate, for one day I get cancer or get, knock on wood, and I should have freaking let the chemo go to my brain. I should have not froze it, because you're 6 hours in a cold cap. That's not okay. I could barely do an hour with my fingers. And I talked to a lot of people, and they said a lot of the girls I talked to were like, it's not worth it. It hurts. It's a lot of time extra that you're sitting in chemo. And one girl I chatted with, she did it, and she ended up shaving her head at the end because she had 30% of her hair and just looked silly. And I figured, let me do the whole cancer thing cold turkey. I'm not gonna, try to cut any corners. And I did it all. So
Yeah. One of the survivors that I spoke with did stick through with it the entire time and was able to keep her hair because of it.
that's awesome.
Um, yeah, but you're right. Everybody does it differently. I lost all my hair. I got to keep dumb things like my chin hair, my mustache and shit like that. But I lost. I came home one weekend and my sister looked at me and she's like, I'm like, I have no eyebrows, like but I got to keep the dumb hair, really. Like
Yeah.
some of the underarm hair and some of the leg hair stayed, but all the hair I wanted to keep disappeared, right? Like,
Oh, I love honestly, the worst part was the nostril hair. That was the first to go, and like everything's just coming out. I'm like, oh my God.
it's amazing how much the hair helps, right? Like, and you find out in weird ways when you don't have it anymore, and you're like, huh, okay, so
Yeah.
that helps with that, I see.
Yeah. I mean, honestly, the first to go was my pubic hair, and I was really happy. It was great. And then as the first to come back, I'm like, damn it.
I I knew I was gonna lose my hair, so I rocked a mohawk for a little while, and then we shaved my head. And even though I knew I was gonna lose my hair, I forgot about my pubic hair. So when I came home after being inpatient 4 days, the first thing I did was shower and lose all my pubic hair in my hand, and then melted onto the floor of the shower and cried for 45 minutes because because I just lost all my pubic hair and I should have known, right? But like common sense goes out the window the second you have a cancer diagnosis. Common sense doesn't work. It does not. Um, but yeah, I did do wigs, but I didn't do traditional wigs. I showed up for radiation, in head to toe powder powder pink, including an I Dream of Jeannie bouffant wig. And the nurse behind the counter, she's like, "Oh, honey, let me get you back up to the fifth floor," which is where psych was. I'm like, "I'm here for radiation." She's like, "Oh my God."
That's so freaking funny. Yeah, I mean, I was similar to you. I try to make chemo like as entertaining as possible. I made so many TikToks. I was like getting permission from the nurses. I'm like, "Can I step on the IV machine?" And my sister pushed me around in the hallway to make a TikTok, and they're like, "Well, no, but if we're not looking, then like." So like because my hospital was super like elderly. Like I was at the Miami. I'm at the Miami Cancer Institute, and it was sad. All my friends and family that would come are like, "You don't belong here. Like, look at these people," and it's like, no, these are my people. You know what I mean? But when I would walk in with my bright pink outfits and crazy fluffy shoes, like everybody would laugh and like they're like, "Oh my god!" So sometimes like I would wear the big sparkly sunglasses and be dancing while the chemo ports in. I mean, you saw my TikTok, my chemo
Yeah,
things in here, and I'm like twerking and dancing, and I was like, I try to make the best of it.
that is part of the survivability as far as I'm concerned, right? Like by the I walked into that radiation every day wearing a different color wig. They started betting what color it was going to be, right? Like having humor during such a
Dark
dark time.
humor. I had the
Yeah,
worst. My
yeah,
mom was so mad at me. Like, she would be like, "I don't understand why you're acting like this. Like, it's not funny." I'm like, "Mom, it's the only way to get through it." Like, and some people like they'd look at me and I'm like, "Guys, I'm just kidding. Haha. I'm the cancer patient. I can say stuff like this." Like
yeah.
like if my friends didn't want to do something with me, I'm like, "Guys, but it's for my Make-A-Wish Foundation, please." Like, and they're like, I'm like, "I'm just kidding, but not
The
really."
cancer card. I don't want to do that. Oh, I don't want to do that. Like chemo's really bothering me today.
Oh my gosh. I did definitely use it a few times, to my advantage, but I mean, we weren't lying, we were going through chemo, like, it's the truth.
It was the truth, but there was no reason to. I mean, I guess there was a reason I didn't want to do it. So right, so we don't have to do it. It yeah, it is a super rough time, and you have to remain positive. I don't mean toxic positivity, but I mean have a general good outlook, right? Because how you view a situation is how you proceed from it, right? So if you always have a crappy attitude, you're going to have a crappy day. And I'm not saying that it was sunshine and roses going through that because it's absolutely not, but there are ways to mitigate some of the damages. Dark humor is one way, and wearing funky wigs and just
Embrace it.
yeah, right. And I know that's difficult, and using the word like I'm a cancer survivor, those words are really difficult for a lot of people.
Well, that's why people like you and I who are, like, advocates and talk about it a lot, I think it helps a lot of people. I know there's a handful of women who've reached out to me on that from Australia, Europe, China. They're like, "Thank you so much for making videos because we're too scared to like say stuff, and you know what I mean. Like, so we watch your videos and you give us inspiration, and when I first was diagnosed, my mom told me one of her friends reached out to her and was like, "I can't believe your daughter is posting all her personal information online." And my mom was like, "Well, first of all, like, that's none of your business. Second of all, that's her way of coping. By her helping other people is helping her. When I'm sitting in the hospital for a week straight due to complications, instead of sitting there looking at the ceiling, I'm texting girls like, all right, try this chemo cap, do this, do this. It just gets my mind off of it and it helps me. It makes me feel like I have a sense of accomplishment, like I found my purpose, which is kind of messed
No,
up. But
that's not cheesy or anything. I honestly believe that this is my purpose too, and that I was led through that journey so that I can help other people. The entire point of me doing this podcast and my other advocacy work is so that I can be the resource I needed and didn't have. When I went through it, there wasn't TikTok. That shit didn't exist.
yeah,
I'm a dinosaur, but it's important to help each other for that reason exactly. Having people reach out to you, be like, "Hey, I really appreciate that you're willing to go on on the internet and talk about pooping your pants or the fact that you don't have any teeth or which, which is both true, right? Like I had a radiation on my abdomen. Poopsidents happen. I could be outside, I could be inside. It doesn't matter.
yeah.
Sometimes it happens. So yes, it does help cope. And I am finding that even now, there's stuff I didn't work through. And I thought I was done, right? Like with the whole like cancer journey
You're
and
never done.
you're not. You're really not. And with each new conversation that I have with a new friend, I learn something else about this damn disease that it's a plague upon the planet, right? Where the current statistic is one in every two will have some kind of cancer, and one in eight it's breast cancer. Like those numbers are disgusting.
Yeah, absolutely.
So anything else you want to talk about? Anything else you want to share?
Um, so right now it looks like I have breasts, but I don't. They're actually called expanders. I don't know if you know what expanders are.
Um, is it inside is it under the skin or is it
So it's under the skin, so it looks like I have. It's not that bright in here, but whatever. Basically, breast cancer patients, what we do, I had a bilateral mastectomy, so I had both of them, removed with nipple sparing. So I still have my nipples, which is like a new technique a lot of doctors are able to use if there's no cancer inside the nipple. So when they go in, they double check and they see and if they don't see any cancer in there, they'll obviously send off the tissue under the nipple to get it biopsied. So what we do instead of just going flat, especially a lot of younger women, they don't want to just be flat. So we do reconstruction. And some people qualify to immediate implants. So some people will wake up with immediate breast implants, and some people, like myself, don't qualify for that. So we have to do something called tissue expanders. So tissue expanders are basically like an empty, hard breast implant that they fill with saline. They pump us with saline to kind of like expand your chest wall and your tissue and your skin to get ready for an implant. So that's what's inside me right now, and they're rock hard. Like if you just imagine two giant boulders on me, so it's kind of like they're very heavy, but they're just pretty much taming my skin to get ready for my boob job, which will be in 2 weeks. So that will be my last surgery. That'll be surgery number eight out of eight in 8 months.
wow,
I've
that
had a lot of surgeries. Yeah,
that's pretty intense, right? Like
yeah, it was a lot. A
going
lot.
going 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 through the detectors at the airport must be a pain in the butt.
I haven't traveled. I've been too scared just because, to be honest, I've had a lot of complications after surgery. I had a staph infection. I had about a month and a half ago. I had a staph infection. I woke up another surgery with a hematoma the size of a
Oh
melon
my
right
God.
on top of me. So I've had a lot of like complications, and I'm too scared to like be far from my doctors because I was visiting my parents an hour and a half away, and I was ended up being hospitalized, and the care sucked. Like a lot of like urgent cares, first of all, they won't take cancer patients because they're too scared. They don't want to mess anything up. And then when you go to a new hospital, it's like you go on the oncology floor, but the oncologist as a basic, oncologist for all types of cancer. So like they don't know your specific need. So it takes a while to like get in contact with your doctors and all that. So I just wanted to be able to like be home. So I
Yeah,
haven't traveled. I also started a new medication. So my cancer is hormone positive. So it's coming from estrogen, which is coming from my ovaries. So I'm on this medication that's suppressing my ovaries and putting me into menopause. So I
you're
have all
33.
I just turned 34, yeah. So I have all the symptoms of menopause. And I had my first weird side effect yesterday. The room was spinning. I was really nauseous. So I'm just kind of scared to be anywhere not normal until everything's done and like I have like a routine. My medications, I go in for a shot that's like this big. It's like a 16 gauge. It's the fattest shot I've ever seen. Once a month into my stomach. Um, so I also have to plan, my life around when I have to go in for my injection. So there's a lot that younger cancer patients have to deal with because we have to suppress all those hormones coming out of us.
Well, I was 38 when I was
So you
diagnosed. So I went into immediate menopause, right? Nothing's more fun than
sweat in the bed every night.
I honestly got away with a lot of not having to deal with many side effects. I was fortunate in that regard. But
Lucky.
yeah, like and the younger and younger patients are getting cancer. And so having to worry about things like where your nearest doctors are that have good quality of care that you're expecting, right? Being in a big place like Miami, you'll get good care. I'm up in
Mhm.
the New York City area. Um, some of the rural places is a little different, right?
I've talked to a few ladies who are like, "Oh my gosh, my doctor doesn't have this or that." And I'm like, "Find one that does. If you gotta drive 2 hours, go to the closest city because one mistake, one thing the doctor might not give you or that you need or something, it could be your whole life right there."
It could absolutely, yeah,
And also, I would recommend getting second opinions too. Always, especially with the more complex cancers, like the stage threes, the stage fours, lymph node involvement and all that. Just because a lot, even like the Miami doctors, there's a hospital that I go to, and there's a hospital right down the street, and 25 minutes from each other, and they have different opinions on what to do in certain situations. So it's kind of
different
like
protocols. And
different protocol.
you also have to decide what you're comfortable with and what feels intuitively right for you in your situation, right? The doctor can be completely right, but it's not right for you. And that will make a difference because if you're not fully aligned with the program that the doctor's laying out, there's going to be issues.
Yeah. Well,
You
that was the
really,
thing, like, for me, I did so much research and I was bringing this information to my doctor and he's like, "How do you even know about that?" Like, there's, like, one point where he's like, "All right, it's time for us to freeze your eggs. Have you thought about it?" And I go, "I did that 2 weeks ago." And he's like, "You don't even need me." I'm like, "I know. You didn't tell me any of this. I did my own research." So sometimes you just have to figure it out. And then I did it. My doctor didn't even know I was doing IVF because I went, got my eggs frozen. All right, what's next? Chemo? All right, let's do it. And he was just like, "How? Okay, good for you." Like, okay, all right. But I did everything quick. I want this done. That's it. I'm not going to linger and wait for my doctor to call me. I'm going to do it.
yeah, yeah, it's a lot, an awful lot. And it's kind of like a roller coaster and you're kind of still in it, right? Because you haven't finished treatments as it were. So it's still very brand new for you, right? Like for me, it's very old car smell, right? Been here a while. And for a long time, it was everything was cancer, cancer, cancer. And I didn't see an after what possibly could be there, like, a life beyond cancer. Is that something that you like? Do you think about the future and
I do, yes. The number one thing being I don't have children yet, and I do want children. So being on, hormone suppressants and all of that, the effects of chemo on the ovaries, like, can I bear my own children? Do I need a surrogate? I have eggs frozen, so at least I'm prepared for that. But I have also talked to a couple other women who had cancer. They beat the cancer, got pregnant, had their children, and got breast cancer immediately after because of the hormones. Like, you know, things are going up, things are going down. So to me, it's like I just have to kind of, stop listening to what other people say. Do what I think is right. And that's the thing. Everyone's journey is different. If I
Yes.
have my own child, if I bear my own child, I might not get cancer, but the other girls that I talked to did. So it's like there's always a double-edged sword. If I do hormone therapy, there's a chance I can't bear my own children. But if I don't do hormone therapy, there's a chance my cancer comes back in the next 6 years. So it's
Yeah.
like, what do you choose? And that's the problem. Everything with cancer is double-edged sword. For instance, I had to go to a cardiologist yesterday because if I take my long-term hormone therapy, there's a chance that I can have heart disease. I have to go for a bone scan and a bone density scan next week. I have 2 scans. If I do this hormone therapy, there's a chance I can get osteoporosis and mess up my bones. So it's like, do you want osteoporosis or do you want cancer? Do you want heart disease or do you want cancer? It's like you have to pick the lesser of the both evils.
Yeah. Right? Like, how about no thank you? Like, how about none of that? That all of that sounds disgusting. I choose not that.
Yeah. But this is the life that we were, dealt. And you know what? It is what it is. You're going to choose what you think is right. And
Yep.
that's it. Just got to do it. And that's what I'm choosing to do, hormone therapy. That's why I have all these tests and stuff. But, I'd rather live a good, nice life without cancer, for a while rather than, my chance of getting cancer coming back. And they said like 9 years. I had a chance of it coming back 23% in the next 9 years if I did not do chemo and hormone therapy.
Yeah.
So I was like, lower my chance, whatever I could. Give me it. Give me chemo. Give me the hormone. Give me whatever. I want my chances to be way lower. So
Yeah.
I knew I was doing
Absolutely.
chemo. My doctor was like, go home, think about it, and call me and let me know. I go, no, 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 no. This is my decision. Sign me up for chemo right now. Within 3 days, I had chemo. I had my chemo poured in. The next day, I had chemo. We did everything really quick.
Yeah. That power port is an amazing thing.
Did you have it or you had to go through your veins?
So my oncologist asked me if I wanted a port. I didn't know what it was, so I said no, and he didn't explain it. So my first round of chemo, I went with no power port. I went in for round two of chemo, and it took an ER nurse 45 minutes to tap my vein. So we got myself a port for the rest of the
Yeah. My
yeah.
friend, who I grew up with, she did chemo and they didn't offer her the port either. And they blew out every single one of her veins. And now she has to like draw blood and stuff. Like everything had to go through her neck. But I mean, even because they remove a lot of lymph nodes from my right side of my body, I can't get anything done on my right side. I can't do blood pressure. I can't get blood drawn from this side. Um, they don't want you to like shave with a razor, get your nails done because you have a chance of getting lymphedema, which
Yes.
is when your arm gets really swollen.
Yep.
So everything has to be done on this left arm. And it comes to a point where like I was in the hospital and they kept, there's just so much IV and blood they could take from one, and they couldn't find. They had to have like ultrasound tech come in and find veins. I had my last hospitalization. My IV was going through in here.
Yeah.
I was like, this is a really weird spot.
Yep. Yeah. And these are things that you don't think about, right, at all when you're healthy. Like,
No, I knew none of this. Like, this was so foreign to me. I mean, I knew no one my cousin's mom had cancer and breast cancer, and my friend growing up. And that was it, those two people. But my journey was like so different from theirs. Similar in some ways, but no one's the same. You're never going to meet one person that's going to be the same.
no, of course not. It's all very different, and it's super overwhelming. So, find your tribe, right? Like there are definitely with social media where it's at nowadays, access to other people who are walking the same journey. We're everywhere. We're absolutely everywhere. It's a lot more available than it was when I was going through my journey. I didn't have very many resources. I had a very good support network, a friend network that wasn't part of the cancer community. I was very fortunate, but in this day and age, access to people who are willing to talk to you about it. We're all here.
Yeah, 100%. I mean, I can't begin to tell you what my Facebook inbox, my Instagram, my TikTok, and I talk to I will not ignore one person. I will talk to every single person because I was that person reaching out like, "Oh, oh, what do I do? What do I do? Like, please give me advice, give me advice." And you know what? I will like you said earlier, you said it perfectly. You never want anybody to feel the way that you felt when you were diagnosed.
Yeah, exactly. I It's so brutal navigating a cancer diagnosis. Nobody should ever have to do that by themselves.
Absolutely not.
And even with support, it's still fucking brutal. There's no
It's
other way of saying it. It is brutal.
very true. And for me, I was single throughout my entire journey, and I felt like if I had a significant other to be there for me, maybe, my lonely times or, someone just to like rub your back or your hair might have been a little bit easier. But I did a lot of things alone. I mean, I'm in my city. I'm here alone. Like my family, they're like an hour and a half hour away. So like they're close enough, but I did navigate everything. I would say 80% of my doctor's appointments, procedures, and all that I did by myself. And I always thought maybe having a significant other would made it a little bit more fun, or maybe like a little bit less, like more bearable. But at the end of the day, you only have yourself. So if you can't do any of this alone, I think it made me stronger by doing it alone. Like I would call my mom right away, be like, "Oh my god, I just got poked with the biggest freaking needle. Like, you believe this?" But while I was getting poked, there's a empty chair next to me, which I almost wish, somebody would, be there, but
Yeah.
this generation I live in. So I was not, I'm not dating throughout this journey. So, but I did everything alone. I feel like it made me stronger as well.
So when I went through my journey, I was single and I was like, all right, fine. Hysterectomy means I'm never gonna have any kids. 5 years later, I started dating this man with 3 children, and now I have 3 kids, and one of them I have adopted. So you really never know what life is gonna give you after the shit sandwich of cancer.
Yeah. Well, at the end of the day, I know I have to get a hysterectomy. So that's the next step after all this. So that's the thing I have to decide now. Okay, when do I get that? Do I wait and maybe eventually I'll start dating and want my own kids, or should I just get rid of it now? And then I would be so open to dating a single father and adopting kids. I surrogacy. I have eggs frozen, so I'm not really concerned about that. But yeah, it's like everything happens for a reason.
I uh I know how I would respond if I ended up with breast cancer. They're just going. And I've already made that plan. I made that plan 17 years ago, right? Like there's no question, they're just going. I have breast cancers in my family. I have lots of cancers in my family. I'm not playing any games. The
Don't.
second the second the second they say they got to go, they are going. So and that's a deeply personal decision, right? Like so I know that for me, like it if hormones were causing the problem, I would get the equipment moved right out immediately. But my decision doesn't work for everybody.
Yeah. So I obviously that's my I'm like you. I'm like, get rid of it all. But the problem is that you know what it's like being young and getting rid of it. There's also a lot of side effects. I have heart disease in my family. So
Me too.
they are concerned that if you remove the ovaries too quick, that could trigger that. You know what I mean? Like, so there's a lot of, so I saw the cardiologist, I had EKG, I'm going in for a bunch of blood work and stuff like that, just to like see my options. And, that is going to be the end goal for a hysterectomy. It just depends on when, I think my body should not be put under any more anesthesia in the next year or two because I've had so much anesthesia. I don't know
Well,
how
then
much,
wait 5 years.
yeah, maybe 2 or 3 years. But yeah, I mean, it's just a decision. But I'm like you, a lot of women that I talk to, because my cancer did not spread, so I did not need a mastectomy. I did not need one. I only needed a lumpectomy to remove it because there was no lymph node involvement. There was no other tumors. But I made the decision to do the double mastectomy because, first of all, I belong to a nonprofit in Miami, and most of them consist of women over 60, like 60 to 80. And I talked to a lot of them, and they were like, listen, we are like 14, 15, 16 years out of being cancer free. And people who get the reoccurrence are usually the ones that don't get the mastectomy. They're the ones who just get the lumpectomy. If you don't get a mastectomy, there could be microscopic cancer cells crawling around. You don't know. You don't know. And you know what? I got the mastectomy. They tested all my tissue out and there were 0 cells, but I don't care. I don't care that there was 0 cell. I'm happy, but I just, for a peace of mind, that I know that I was aggressive. I did whatever I could in the beginning, and there could be microscopic cells in there that the biologist is not picking up. You know what I mean?
Yes, I do. Yep.
You don't know. So can you see me? Because my computer is like kind
Yeah,
of,
you're fine.
okay. It's saying something's idle. Okay, there we go. But like for me, because everyone's like, you're crazy, like you don't need a double mastectomy and all that. I'm like, no, you do. You really do. And everyone who had reoccurrences that I have talked to in my life, they all had lumpectomies only. So now the advice that I give people, I will never tell anybody what to do. Oh, you're stupid for doing that. I would never, ever, ever. I would give
No.
them my reasoning. This is what I did. You know what? You make
Yep.
your decision, but this is what I did. And when I made my doctors did not tell me what to do. They didn't tell me to do chemo. They didn't tell me to do a lumpectomy. They told me nothing. My doctors presented options.
Yep.
This is a lumpectomy. This is what we do. This is a mastectomy. This is what we do. This is chemotherapy. This is what it does. Now you pick what you want. After I picked everything, I chose and I started everything. My doctors said, you made the right decision. We couldn't, they can't tell you that beforehand. But after I made all my decisions, they said, if I was you, I would have done what you did too.
Yep.
So the
Exactly.
doctors know that's the right thing to do, but I don't think they're allowed to tell you, because what happens if you get a mastectomy and you still get a reoccurrence? Then the patient's going to say, well, my doctor said I won't get a reoccurrence if I get a mastectomy, like, so
Yeah.
it's like kind of saving their butts. But I would tell any woman, just go aggressive. If you're at the point where chemo might not be needed, but like it's kind of a gray area, get the fucking chemo. Just do
Yep.
it.
I agree, right? Like an abundance of care, right? Like when it comes to it. But that's my personal, that's how I would do it.
Yeah.
All right, well, Krystal, it has been absolutely fantastic having you here, and I really appreciate you coming and sharing your story with us.
Thank you for having me. I'm gonna continue following your story and keep me updated too. I want to know how your biopsies and everything go. Um,
Absolutely.
and any way that I can help you, if you have a friend that needs some advice or anything, I'm always, available on email, TikTok. I have my email, my Instagram, everything on my TikTok too.
Same. Could always send somebody my way if they're, older or they're dealing with uterine stuff. I'm more than happy.
Awesome. Well, I
So,
appreciate it.
yes. So until next time, Cancer Warriors, go get your testing.
Get your testing every year. Don't miss it.